I will remember that there is art to medicine, as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. Part of my oath as being a physician was promising that, irregardless of what the circumstances, that I will join my colleagues and we will provide care and healing to people in need. 4 years ago, Dr. Vicente Diaz mentioned what his dream was: to have a medical mission involving volunteers participating in giving free care to those that did not have the ability to receive that care. We decided to embark on this journey with the help of Julio Carvalho. He was able to leverage getting a host to sponsor us. He was able to coordinate with the mayor of a town in Guatemala, Tecun, Uman. There's a lot of different feelings that I feel about going to another place and practicing medicine this way, and not having the restraint of whether or not someone has insurance or whether they have ability to pay. Healthcare and the right to live a healthy life is actually a human right, and not something that is a commodity, something that should be bought or something that should be paid for. There's no price for the health of a loved one. During the week that we were there in Guatemala, we served approximately 3,000 patients, and we had waiting rooms filled with about 400 to 500 patients that had no means to seek health care. Dr. Vicente Diaz provided surgical management and therapy in Santo Domingo in our prior mission, and during our Guatemalan mission, he ran the ophthalmology clinic where we did vision screening, cataract screening, and intervention. He also provided management for various conditions. We had a triage set up with experienced nurses, and some of the students helped out with that. They asked the right questions, they took the vital signs, and they came up with a tentative diagnosis for some of the patients, which helped kind of move things along quickly. We set up a pharmacy where we purchased antibiotics and medical treatments and vitamins and things that we needed to treat various conditions. I think our team, because we've already done it in Santo Domingo, got very creative. We were prepared for whatever came our way, and it's very comforting to have a team that can respond. I would say the take home that I learned is that with limited resources, patients that lived in these countries still had the hope and the dreams of being well and having opportunity. Why is this important? It's because if you're going to be a caregiver in the United States, you have to know your patients, and you have to remember about the art of medicine. You can't learn that from a textbook. This is cultural competency at its best. This will enhance the ability you have to deliver healthcare. The dream of Hermandad Health is that we can inspire others to spread their goodwill, and we have to respond to the need that exists. That was a dream of starting this and practicing medicine without restrictions, without the thought of profit. This type of experience makes us healers and not just doctors.